Today, topic of my discussion is effect of serum lipid profile on breast cancer. So this is an overview of my presentation, that is a little bit background on breast cancer, then comes what is a serum lipid profile, then how lipids might affect cancer risk and progression, and then comes key findings from research, and finally what are the clinical and therapeutic implications. Breast cancer is a global concern that is most common cancer among women globally. According to data, it is a malignant condition that is affecting about 2.1 million women worldwide, and the incidence is rising, especially in developing countries nowadays. And what are the risk factors for breast cancer? Genetic, that is some mutations in the genes like BRCA1 and 2, they are inherited and they carry the risk of CA breast in families. And then comes hormonal. In hormonal, early menarche, that is before the age of 12, late menopause after age of 55 years, nulliparity are the first child after the age of 30 years, and then not breastfeeding. They also increase the risk of breast cancer. Then comes environmental factors, that is exposure to radiation, especially chest area that is exposed to radiation, that also increases the risk of breast cancer, and certain chemicals. Then comes lifestyle factors, that is obesity, overweight, physical inactivity, increased dietary fats, then smoking, then lack of or short duration of breastfeeding, and again low parity. These all carry an increased risk of breast cancer. And then systemic diseases like hypertension and diabetes that needs to be addressed. Okay. Then what is understanding the serum lipid profile? That is, total cholesterol is a structural component of cell membrane. And LDL, that is low density lipoprotein, delivers cholesterol to the cells, while HDL, high density lipoprotein, that removes excess cholesterol. And triglycerides, these are energy storage molecules that are linked to metabolic syndrome. And what are the possible mechanisms linking lipids to cancer? Cholesterol as a precursor to estrogen synthesis that influences estrogen receptor responsive tumors. And LDL promotes cell proliferation and inhibits apoptosis, while HDL's antioxidant properties may be protective, as is in ischemic heart disease. High triglycerides may promote inflammation and insulin resistance. Changes in concentration of serum lipids in patients with breast cancer will result in an increased production of tumor necrosis factor alpha. That in turn leads to inhibition of adipose lipoprotein lipase activity by insulin. And finally, these changes will impair the catabolism of LDL cholesterol. So besides the proliferating cells, such as cancer cells, have increased requirement of cholesterol and facilitate lipid biosynthesis and metabolism, that will finally lead to increased serum cholesterol levels in patients with breast cancer. So what does scientific evidence say? Lipid levels and risk. Meta-analyses suggest high cholesterol is linked to increased breast cancer risk, while low HDL levels correlated with poor prognosis. That is same as in ischemic heart disease. While elevated triglycerides are associated with larger tumor size and lymph node involvement. However, some studies show no clear link up till now. Estrogen receptor and progesterone receptor responsive tumors are more responsive to changes in lipid environment, while human epidermal growth factor receptor and triple negative breast cancer show different lipid metabolic activity. It depends upon different types of breast cancer, while lipidomic profiling helps to distinguish tumor aggressiveness. So, what does a statin can do in CA breast? That is a promising avenue that statins lower cholesterol by inhibiting HMG-CoA reductase. While preclinical studies, statins reduced tumor growth and metastasis, while clinical trials underway to test statins as adjunctive therapy, and potential anti-inflammatory and immunomodulatory effects of statin also have an effect. And what are the therapeutic and diagnostic implications? Lipid profile is used as a prognostic biomarker, while integration into breast cancer risk assessment tools. So lipid lowering drugs are used as a part of treatment plans now. So personalized medicine based on metabolic profiling is needed. These are few researches that shows a link with breast cancer. The association of serum lipid levels with breast cancer risks among women with breast cancer at Field Harvard Comprehensive Specialized Hospital, Northwest Ethiopia, that was published in Breast Cancer Targets and Therapy volume in 2020, that concluded the overall prevalence of dyslipidemia was high in breast cancer patients. Again, age at first priority, alcohol consumption, and BMI were significantly associated with low serum HDL cholesterol levels. And again, low HDL cholesterol levels carries worse prognosis. And another article was evaluation of the blood lipid profile pattern in female breast cancer patients in Jordan, that was published in 2024. That was concluded as this study showed a clear correlation between increased BMI, altered lipid profiles, and an increasing risk of breast cancer in women living in Jordan. And this was a comparison of serum lipid profiles between normal controls and breast cancer patients that again showed a high level of triglycerides, low density lipoprotein, and low level of HDL in cancer patients. So all these results, they suggest that increased serum lipid profile may associate with breast cancer risk in women. So further studies to group important factors including cancer stages, types of cancer, parity, and menopausal status that may affect to lipid profiles in breast cancer patients, along with an investigation of new lipid profiles to clarify most lipid factors that may involve in breast cancer development, they are needed. So these are the challenges in research that need for standardized lipid measurement in studies, variability in populations and methods, confounding factors like diet, exercise, body weight, and genetics, and limited international studies establishing causality. So I conclude my presentation over here that lipid metabolism plays a complex role in breast cancer, and serum lipid profile could aid in risk prediction and treatment. So multidisciplinary research is key to future breakthroughs. Thank you very much.